Angels of Death. In the sterile corridors of hospitals and nursing homes, where trust is sacred and lives hang in the balance, a chilling paradox emerges. Caregivers who kill. Welcome to Angels of Death, a series that delves into the sinister minds of professional caregivers turned serial killers, nurses, doctors, therapists who betray their oath to heal. These are not crimes of passion or profit, but acts shrouded in the guise of compassion. Why do they do it? What drives a healer to wield death as a tool? Is it a thirst for control, a twisted need for attention, or something more lurking beneath their clinical facades? Each episode unravels the eerie psychology of varying figures who perhaps wanted to play the hero, or whose supposed care claimed many lives. What compels them to kill repeatedly, slipping through the cracks of trust and oversight? Do they revel in the power over life and death, or are they driven by a compulsion they simply cannot escape? Through chilling case studies, expert insight, and haunting reenactment, I probe the motive, be it narcissistic validation, psychopathic detachment, a warped sense of mercy, or something else, that transform caregivers into predators. Angels of Death is a descent into the shadows of human nature, where the line between saviour and monster blurs. Join me as we ask, how do these killers hide in plain sight? What do they gain from their deadly acts? And why does the system fail to stop them? I will take you through a gripping exploration of the darkest corners of caregiving, where the hand that heals can also kill. Niels Högel was born on the 30th of December 1976 in Wilhelmshaven in Germany. Little is publicly documented about his early life, but he trained as a nurse and began working in medical settings, including intensive care units, where he had access to vulnerable patients. Between 1999 and 2005, Högel worked at hospitals in Oldenburg, 1999 to 2002, and Delmenhorst, 2003 to 2005, where he deliberately administered drugs to induce life-threatening conditions, primarily cardiac arrhythmias, in patients ranging from young adults to the elderly. His stated goal, as revealed in confessions, was to resuscitate patients to impress colleagues and gain admiration, though many victims died due to the severity of the induced crises. Authorities estimate he killed at least 85 patients, with suspicions of up to 300 deaths, as some bodies were cremated, complicating evidence collection. Högel's crimes were detected after colleagues and data analysts noted an alarming increase in ICU deaths during his shifts. In 2005, he was caught injecting an unprescribed medication in Delmenhorst, leading to a 2008 conviction for attempted murder, 7-year conviction, and a 2015 conviction for 2 murders and attempted murders, life sentence. In 2018, he faced charges for 97 additional killings, admitting to over 100 murders. Högel's primary modus operandi was injecting patients with drugs to induce cardiac arrest, aiming to resuscitate them and appear heroic. He confessed to enjoying the thrill of resuscitation and the admiration from colleagues when successful. This is a very clear indicator of engaging in a manner whereby he demonstrates an absence of emotional empathy in the pursuit of fuel. He won't know it as fuel, but the thrill that he receives from the resuscitation and admiration is the sense of power that he experiences from the receipt of fuel. He used drugs like lidocaine to cause arrhythmias, then attempted to save the patients, though many died. Colleagues noted his eagerness to be involved in emergencies, often volunteering for high-risk cases. His behaviour persisted despite the high mortality rates, suggesting a compulsive need for validation. His behaviour aligns strongly with a narcissist's need for admiration and grandiose fantasies of power or importance. Högel's desire to be seen as a hero reflects exaggerated self-importance and grandiosity, and a need for the provision of fuel, consistent with narcissism. While manipulation for personal gain is also a psychopathic trait, Högel's focus on admiration rather than material gain or sadistic pleasure differentiates from typical psychopathy. His actions were goal-directed in terms of recognition, as opposed to necessarily impulsive. Högel's actions resulted in at least 85 deaths, with victims including elderly patients and younger adults, indicating a complete absence of emotional empathy. He continued his killings despite knowing the lethal risks, showing complete indifference to patients' suffering. During his trial, he expressed regret for the pain caused to families, but showed minimal emotional connection to his victims, describing his actions as a game to test his skills. This is demonstrative of the objectification of his victims. He had a cold and detached demeanour when discussing the deaths, demonstrating emotional shallowness. Högel's detachment appears beyond that of a narcissist, and whilst there was the objectification that is seen with a narcissist, his detachment appeared to be more leaning towards psychopathic than the simple narcissistic self-centeredness. The affective factor, in terms of shallow affect and a lack of remorse, strongly applies with regard to psychopathy. His indifference to his victims' deaths and his description of killing as a game reflect a profound lack of remorse and emotional depth. However, his lack of sadistic pleasure or predatory aggression rose back somewhat from psychopathy. Högel's stated motive was to gain recognition through resuscitation, but the high death toll suggests either incompetence or indifference to outcomes. He admitted to feeling a rush during emergencies and enjoyed the praise when he saved patients. The Shipman Inquiry and studies on medical serial killers suggest that such killings are driven by a need for control and validation, which, of course, are key indicators of narcissism, as opposed to necessarily financial gain or sexual gratification. His persistence, despite detection risks, indicates a compulsive drive. There's no evidence of torture or actual pleasure in suffering, only in the act of resuscitation, which points more to the necessity of manipulating a situation in order to gain admiration. His need for admiration and grandiose self-perception, i.e., he saw himself as the heroic saviour, very much aligns with narcissism. His killings served to bolster his self-image as a skilled nurse. He had an exaggerated version of what he was. The scale of harm might, however, go beyond that of a typical narcissist. Psychopaths often kill for dominance, thrill, or material gain. Högel's rush during resuscitations might be viewed as thrill-seeking, but it's clear that his primary motive was admiration, and that was far less predatory. His methodical approach goes against impulsivity, which distinguishes him from certain psychopaths' lifestyle traits. Högel was described as charming and competent by colleagues, enabling him to gain trust in high-stakes ICU settings. However, he also exhibited personal crises, including reported low self-esteem and pathological lying, for instance, exaggerating his skills. His ability to maintain a professional facade while killing suggests a double persona, which is common amongst both narcissists and psychopaths. Colleagues later recalled off behaviours, such as an unusual eagerness to handle emergencies, which they overlooked until the death toll became undeniable. His stable employment demonstrates a more evolved type of narcissist, contrasting with the chaotic personal lives that can be seen with some individuals that go on to engage in serial killing. A narcissist, or certain narcissists, will utilize a charming facade to gain admiration and utilize troubled relationships owing to entitlement. Högel's charm and need for validation fit this. It appears that his behaviours don't show a huge amount of grandiosity, but the vulnerability that it is exhibited as a means of gaining sympathy and control would accord more with a hypersensitivity. Högel also maintained trust, which might be said to enable him to excel at superficial charm and manipulation. However, his lack of widespread interpersonal chaos or predatory behaviour in a more stable way tends to row back in relation to psychopathy. Furthermore, his stable job and lack of criminal versatility also leans more towards narcissism than psychopathy. There's limited data in relation to Högel's childhood, but reports suggest that the need for approval, possibly exacerbated by his nursing role, where he could wield power over life and death. He didn't have a prior criminal history before 2005, which suggests that his behaviour emerged in the medical context rather than was something that was pervasive throughout his life. Unlike many serial killers, there's no documented history of childhood abuse or juvenile delinquency, although it can be the case that certain medical serial killers will have personal crises driving their behaviour. His choice of victims, who were diverse in age and often vulnerable, and the method, drug overdoses, reflects his medical access rather than specific victimology. His need for admiration again links with the nursing role that he took on. We don't see early conduct problems that would ordinarily be found with psychopathy. The absence of documented juvenile delinquency or broad antisocial behaviour tends to suggest that full-blown psychopathy was less likely. His killings were context-specific, i.e., they took place in a medical setting and were not reflective of a pervasive antisocial lifestyle. Högel's need for admiration through these resuscitation attempts, his grandiose self-perception as a heroic nurse, the charming facade, his sense of entitlement, the objectification, the absence of accountability for discharging his nursing role as he ought to properly do so, his lack of boundary recognition in interfering in the lives of those that he injured and killed, the fact that he experienced a rush, a very clear description of the experience of fuel, all support that he was very much a narcissist. He certainly engaged in attention-seeking, and he had profound callousness. He wasn't overt. For instance, there was no public boasting of what he achieved, and instead he was more focused on the medical crises and how that served his own needs vis-a-vis his colleagues, rather than the more wider need to involve the public. The absence of remorse, his shallow affect, his ability to kill repeatedly while maintaining a professional facade support the presence of psychopathic cunning. He doesn't exhibit impulsivity or pervasive antisocial behaviour. The lack of prior criminal history, stable employment, and context-specific killings linked to medical settings rather than a pervasive lifestyle. His motive, which was admiration rather than dominance or sadism, and a lack of predatory aggression, tend to differentiate him from out-and-out psychopaths. Overall, with regard to the behaviour of Niels Högel, the outcome would be that he would be a narcissist with some psychopathic traits. I'm HG Tudor. Thank you for listening.